Good afternoon. If you're just tuning in, welcome to APAICS's inaugural Health Summit. I'm Madeline Milka, President and CEO of APAICS, the Asian Pacific American Institute for Congressional Studies. Thank you for joining us as we dive into a panel discussion on the important topic of data disaggregation. Before we begin, it's my honor to introduce Congressman kahele for opening remarks. Congressman kahele currently represents Hawaii's 2nd Congressional District. He serves on the House Transportation and Infrastructure Committee and House Armed Services Committee. Before serving the country as a congressional member and in the armed services, he was a commercial airline pilot with Hawaiian Airlines. We are thrilled to have him join us today, so let's welcome Congressman kahele.
E na hoa kako I na olelo kulanalana aloha nui kako. I extend my sincere aloha and mahalo to all of you for your ongoing efforts to document and revitalize our treasured languages. While I have the wonderful privilege of being native Hawaiian and my culture has served as a guiding light throughout my entire life, like many in my generation, I did not grow up speaking Hawaiian, given the impacts of colonization and the suppression of our language and culture. However, thanks to the steadfast generations of kupuna, or elders that came before me, and the tireless efforts of language revitalization advocates like yourselves, I am proud to say that Olelo Hawaii is alive in my home today. The timing of your conference comes on the heels of us having celebrated Mahina Olelo Hawaii, or Hawaiian Language Month, just this past February. And last week, I had the opportunity to speak to my colleagues here in Congress about the importance of supporting our world's languages that are central to our cultural diversity and ultimately our shared humanity. These trailblazing Hawaiian language pioneers would not have accomplished all they have without a clear understanding of the importance of pilina, or relationships. The enduring pilina they have with each other, grounded in an unwavering commitment to ensure that the Hawaiian language shall live, has no doubt propelled them over daunting hurdles and obstacles. Pilina with other indigenous communities nationally and internationally has afforded collaborative learning and advocacy opportunities. Pilina with leaders in various sectors and industries, from education and science to government and media, are fundamental to shifting perspectives about the place and capacity not only of Olelo Hawaii, but all indigenous and endangered languages. I therefore applaud your conference organizers and leadership for focusing on this notion of pilina with this year's theme of recognizing relationships. My aloha again to all of you as you work to build stronger and broader pilina, blazing trails together to keep our treasured languages burning bright for generations to come. Mahalo.
Thank you, Congressman kahele. It's now my privilege to introduce the moderator of our panel, Alana Akhtar. Alana is a breaking news reporter at Business Insider. During the pandemic, she interviewed dozens of frontline nurses and reported on PPE shortages, burnout, and vaccine hesitancy. In 2020, Alana received an award from the Truth About Nursing organization for her coverage on hospital nurses. Alana, I turn it over to you.
Thank you so much for the introduction, Madeline. I am now going to introduce our distinguished panelists. First, we have Dr. Catherine Ceniza Choy. Dr. Catherine Ceniza Choy is a professor of ethnic studies at the University of California, Berkeley. Next, we have Dr. Stella Yi, who is a professor at NYU Grossman School of Medicine in the Department of Population Health. And last, we have Tavae Samuelu, the Executive Director of Empowering Pacific Islander Communities, or APAICS. I am looking forward to having this conversation, but before I begin, I'm just going to acknowledge that we will be using the acronyms AA for Asian American and NHPI for Native Hawaiian and Pacific Islanders in order to ensure all of our communities are represented. And also, for those of you who are watching on Facebook and YouTube, we encourage you to use the comment section to ask questions that may arise during discussion, and I'll ask those questions during the live Q&A at the end of the panel. Okay, let's get started. I will start with Dr. Catherine Ceniza Choy. Dr. Choy, what are health outcomes that we have seen when we start to disaggregate data within the Asian American, Native Hawaiian, and Pacific Islander community?
Thank you for that question and this opportunity. Data disaggregation is so important. The NHPI communities are not monolithic communities. These are communities with unique histories, challenges, and contributions that need to be recognized on their own terms. Much of my research is historical. It has focused on Asian American history and even more specifically on the history of Filipino nurse migration to the United States. And one of the things that I found is that when we start to disaggregate data and understand these unique histories and lived experiences of Filipino Americans during the COVID-19 pandemic, we can see quite clearly the major contributions of Filipino Americans to U.S. healthcare delivery. Since the 1960s, over 150,000 Filipino nurses have migrated to the United States to work in U.S. hospitals and other healthcare institutions. Historically, they have served on the hardest to recruit hospitals, especially public inner-city hospitals, and the hardest to recruit hospital work areas and work shifts. And now, thanks to the research that includes disaggregated data from National Nurses United, the largest union of nurses in the United States, and from AFIRM, which is a transnational feminist organization, we have learned that Filipino American nurses and other healthcare workers are risking and sacrificing their lives in order to save us during this pandemic. COVID-19 has taken a disproportionate and devastating toll on Filipino nurses in the United States. The study by NNU that was published in September of 2020 noted that of the registered nurse deaths in the United States, 31.5% of those deaths were of nurses of Filipino heritage, even though Filipino nurses comprise only 4% of the registered nurse workforce. This toll has been devastating, not solely in terms of lives lost among Filipino nurses and other healthcare workers, but also on the overall well-being and the mental health of the nurses who are still working, the other Filipino American healthcare workers who are still working. And I'd like to close by also emphasizing, by extension, how this is impacting their family members and the broader Filipino American community.
That's quite devastating. Dr. Stella Yi, do you have, what are your thoughts on how health outcomes that we've seen when we start to disaggregate data, how that impacts the data?
Yeah, sure. So I first want to say when we talk about disaggregating COVID-related data for the Asian American, Native Hawaiian, and Pacific Islander communities, it's really important for us to be clear what we mean by disaggregation. So of course, the first level of separation is between Asian Americans and Native Hawaiians and Pacific Islanders. And even within Native Hawaiian and Pacific Islanders, really, distinguishing the fact that Native Hawaiians are different from Pacific Islanders. And then I think from the second level is within these categories, right? So for example, Chinese or Filipinx in the Asian American category, or Samoans and Tongans in the Pacific Islander category. And so when we start to disaggregate on these two different levels, what we see is, for example, the huge burden of COVID-19 on the Pacific Islander community, which we heard a little bit about this morning, but I know Tavae is going to go into this in more detail later in this panel. For the Chinese community, we see the xenophobia, the anti-Asian discrimination, and here in New York City specifically, they have the highest COVID death rates of all racial ethnic groups in public hospital data, and also a high representation in the food service industry. For South Asians, which includes Asian Indians, Bangladeshis, Pakistanis, Sri Lankans, there's a long list of people that fall under the category of South Asians. We see a high representation of healthcare essential workers, so similar to the Filipinx community. We also have reports about increased food insecurity and other issues with food access. And again, here in New York City, South Asians actually have the second highest COVID positivity and hospitalization rates of all racial ethnic groups in public hospital data. So I can't go into detail about all of the different Asian American groups, but I think that gives you some understanding of some of the types of things that start to pop out when we do think about disaggregation. Our group has been working since the start of the pandemic in national coordination with a number of other groups to meticulously track the social media, news, and published literature on the Asian American COVID experience on a daily basis. We are updating this on a daily basis, and we've compiled this into a comprehensive resource. And so this is a resource that we're happy to share with you all or to any of the folks who are tuning in today.
Tavae, did you want to add your remarks?
Sure, thank you, Elena. I'm feeling really grateful right now for Congressman Kahele and the way that he opened the space, not only because it was in language, because he set the context of what it means for disaggregation and how disaggregation allows us to better understand our relationship to each other. So, before really tackling or going straight into health outcomes, there's this fundamental and almost existential question about the purpose of data. What is it that we seek to measure when we invoke data, when we state it? So, where folks will tell me about that they're measuring health outcomes, and I'll tell you that what we're really measuring is the way that racism and poverty manifests themselves in our communities, that we're measuring colonial impact on Native Hawaiian and Pacific Islanders, that we're measuring our proximity, or really distance from whiteness and being able to access things. So it's not as simple as saying that, our health outcomes are that we have the highest rates of cancer or heart disease or diabetes, but that we're clear about that our inquiry is on systems and the ways that they're not designed for our communities. And that we understand that what I measure most closely, what I understand through data disaggregation, is the resilience of Native Hawaiians and Pacific Islanders. Thank you.
Tavae, that goes into my next question that I want to ask you. Are there any benefits to disaggregating data as we continue to fight COVID-19?
Definitely. This really goes back to this notion of the purpose of data, right? That data at its best is a tool like anything else, subject to human error and bias. And ideally, it allows us to really properly and adequately measure the severity of an issue, as well as the efficacy of the solutions that we're proposing. So when we look at COVID-19 data, that of our 50 states, only roughly 20 of them actually disaggregate data, COVID-19 data on our Pacific Islander community. And that of those roughly 20, in the vast majority of them, Pacific Islanders have the highest rates of COVID infection as well as COVID mortality.
Dr. Choy, I know you touched on this a little bit, but how could disaggregating data benefit the fight of COVID-19?
That's a great question. Disaggregating data is so important because it is beneficial. It not only brings up the unique contributions of specific AA and AAPI groups and communities to our healthcare system, but when we know from disaggregated data that some of our communities, like the Filipino American community, is suffering from a devastating, disproportionate toll regarding the deaths of their healthcare workers. It helps us as researchers and as policymakers and community advocates to identify problems and identify the best way moving forward. In other words, how do we address this kind of disproportionate and devastating toll? And so just to give you an example, when we learned about what was happening to Filipino nurses, there was a team of researchers at Brown University's Philippine Health Initiative for Research Service and Teaching who posed the question, why is this happening to our Philippine nurses? And this research team, led by Dr. Jennifer Nazareno, disaggregated data from a national nursing sample. And one of the things that we learned is that Filipino American nurses are concentrated in emergency rooms and intensive care units and working in direct bedside care at nursing homes. And if we continue to do this research, we have a better way of addressing these kinds of issues so that we're saving lives. I'm just going to conclude with one example. If we know about this disproportionate toll on Filipino American healthcare workers, then we need to take that into account moving forward with things like the vaccination rollout. And I do want to publicize that there is a collaborative team led by Dr. Inez Ponce called the Philippine X COVID-19 Resource and Response Team that is a terrific resource and advocate for the ways we can move forward so that we can make a direct connection and improvement regarding our communities.
Dr. Yi, I have a question for you, but before I ask, I just want to have a reminder for people watching on YouTube and Facebook to feel free to ask questions in the comments, and I will ask that in the Q&A. But Dr. Yi, so discussions about disaggregation often focuses on quantitative data, but I'm curious, what are your thoughts on the role of qualitative data in these conversations?
Yeah, absolutely. And I think that Dr. Choy and Tavae can also speak to these issues. We do talk a lot about quantitative data. We do talk about, in fact, it came up a few times during the panel, the opening panel this morning, that we need data and we need data disaggregated. The problem is that, and we've faced this within our own research setting, that even in the face of data, and I think a lot of researchers and advocates are in the same situation, even with data, you have quantitative data in hand, it doesn't necessarily overcome the implicit bias that people have about the Asian American, Native Hawaiian, and Pacific Islander communities. So for example, you can show that an Asian American group or Asian Americans compared to other racial ethnic groups are experiencing disparities, but you won't always be met with sort of buy-in from whether it's scientific reviewers or peers or colleagues, simply because there's just a lot of implicit bias that is still out there when it comes to the Asian Americans. So it's not just about data, and it's not just about disaggregation. It's not just about quantitative data either, as to your point. So, you know, from a qualitative perspective, what qualitative data really brings us is the kind of depth and humanity to the numbers, right? We can't just focus on numbers and say like, oh, we're better or worse than this racial ethnic group or that racial ethnic group. What the qualitative data brings us are those stories that really help people bring to light, like it brings to light for other people who don't experience these things, what the lived experiences are of the people who are going through these hardships is. And again, I think Dr. Choy can speak much more clearly to qualitative data than I can.
Dr. Choy, did you want to add on?
I absolutely want to affirm what Dr. Stella Yi has so eloquently stated, which is that what qualitative data does in combination with quantitative data is it gives a kind of human perspective a three-dimensional, a multi-dimensional perspective of the AA, NH, and PI communities as human beings. And it is so frustrating in the 21st century to still have these communities, our communities, be more well known for one-dimensional stereotypes. There is a direct connection between popular perception of people, not as people, but as stereotypes and as expendable objects. And qualitative data is so important for giving that dimension to our communities as human beings.
Bye.
Yeah, if I can just add and agree wholeheartedly with what you all have shared, I think there's another piece to note that sometimes quantitative data is weaponized against Native Hawaiian and Pacific Islander communities in order to justify our erasure and exclusion, right? That qualitative data is actually fundamentally culturally how we understand ourselves and each other, and it is how we tell our stories, right? That data are stories, and that we contextualize ourselves within, in diaspora, in systems and places that weren't designed for us. And that we've long understood the way that storytelling is a fundamental part of our knowledge production, preservation, and dissemination.
Tavae, what are some good community stories that illustrate the importance of this kind of data?
I mean, so, I love that Dr. Choy had brought up and talked about Dr. Ninez Ponce, because my understanding and what I've heard from her is that what she's doing with the Filipino community was also modeled after the NHPI Data Policy Lab that she's really helped to start at her UCLA Center for Health Policy Research. And that early on, March was when everything shut down. April, in the disaggregation of race and ethnicity data, is when we really saw that the devastating rates of Pacific Islander both death and infection. And so in doing that, in that partnership, right, and that there are ways in which we are able to bridge and have partnerships even in disaggregating data between Asian American and Pacific Islander community and leveraging our strengths. And then this other piece of understanding, I don't have permission to share all of the community stories that I've heard that are most heartening to me. And that when I think about these things, I also think in the context of our cultural proverbs, things like in Samoan, "Efofo le alamea le alamea," which is based on traditional Samoan fishermen, that when you step on the spiky side of a starfish, in order to heal the wound, you turn it over and step on the spongy side. And so this is used to communicate that the solutions that a community needs are going to come from within that community, and that we possess all that we need in order to heal. Like, that's a story that's really guiding all of our work at APAICS.
Dr. Yi, did you want to add on?
Yeah, sure. So I will share what my qualitative experience was from a data perspective very early on in the pandemic. So I'll preface this by saying that it's hard for me to talk about this because we're talking about, every time we talk about numbers, we're talking about people, right? And I think that it's very important for us to remember that when we talk about these numbers, the number of deaths, the infections, the hospitalizations, we're all talking about individuals here. So actually, COVID hit New York City around the beginning of March, and it was probably around the middle of March or so that, so I have a very close colleague in our section for health equity. Her name is Dr. Nadia Islam, and Nadia works very closely with the Bangladeshi community in New York City. She has for many years, and she's worked with, she works with a very large network of South Asian small practice providers. She has a team of staff and community health workers that help serve the Bangladeshi community, and they have a very trusted relationship with them. And so when COVID hit, Nadia was emailing us and telling us that there were she had heard that just from her network that about 21 Bangladeshi New Yorkers had died from COVID. Like, this is just in the first month of the pandemic in New York City. The next day, the number actually went up from like 21 people to like 40 people. That was the count. And then the following week, it was up to 84. So they started to kind of unofficially keep count of the number of people in the Bangladeshi community that were being affected by COVID, that were dying. So on April 8th, last year, I woke up and I checked Twitter, and the New York City Health Department had just released data for the first time, COVID-related data, infections, hospitalizations, and deaths by race ethnicity. So I was very excited to see this, and happy to see this. And I opened it up, and you can see I was like looking at the detail, and they had this kind of detailed table, and the Asian American count was like 112, the death rate, the death number for Asians. And so I was just like, that can't be right. It can't be right. Like, we are hearing from the community that 84 people are gone, and this number is saying it's 112. And this has been our experience. This was our experience pre-COVID. This is our experience now. Like, it is constantly a fight to talk about the missingness of data, the completeness of data, the accuracy of data for Asian American, Native Hawaiian, and Pacific Islanders. And to be honest with you, there haven't been any improvements when it comes to the collection of race ethnicity data at the New York City level, or even the federal level. At the federal level, 59% of data on race ethnicity for cases is missing. And in the New York City area, it's, perhaps not at that high, or it's 50% of the national level, 60% of the New York City level. So, you talk about like data disaggregation, you talk about like data, the data is not even there to begin with. And so you think about how all of that data is being used to then dictate federal policies and allocation of money. It's horrifying when those inefficiencies in the system, in the data collection systems, are not only not capturing disaggregated subgroup, but not even capturing like the Asian American community or the Native Hawaiian and Pacific Islander communities at all. So there's a anecdote just to sort of bring to life like what it is that we're dealing with, really.
Dr. Choy, did you want to add on?
Yes. I'm so grateful and honored to be on this panel with my fellow panelists who've brought such important insights about the knowledge that is within AA, NH, and PI communities. And in regards to your important question about community stories, I immediately thought of two. The first is, I had mentioned the transnational feminist organization Affirm. They've created this website called kanlungan.net. Kanlungan is a Filipino word which means refuge or shelter. And kanlungan.net is a digital memorial as well as a data wall. It is a fine example of bringing together qualitative and quantitative data to present this community of Filipino health workers in the United States, but also around the globe, as people. And one of the ways that they do that is through graphs and numbers that you would typically or popularly associate with disaggregated data, but then they also post the photographs of the faces of Filipino healthcare workers who we've lost. And when you visit something like that, you are really moved that these are not solely workers and laborers, they're friends and neighbors. There are parents, our siblings, and our spouses. And the second example I just want to share about community stories is really more personal. I'm the daughter of Filipino immigrants. And I just wanted to share that I keep in touch with my Filipino American mom who's based in New York City while I'm here based in Berkeley, primarily via phone. And we've been talking about the vaccine. she's had so many concerns about it. And even though I've done research on like history of medicine and migration and so forth, I'm still her daughter. So she views me primarily as her daughter. And so I told her on the phone, you know, there's this great resource called Tayo Help. That's T-A-Y-O Help, which is right now based in Los Angeles, and I hope it will spread in the United States. But it translates as let us help. For the primarily for the Filipino American community. And some of the advocates of Tayo Help posted videos of taking their elderly parents to vaccination sites and getting vaccines. And so I shared that with my mom. And now when we talk about vaccines and the importance of getting one, she says, oh, I just loved that video. And she could relate to that experience because she saw herself in that, and she saw her and I in that experience. And now, even though she's still concerned about the vaccine, she's on her way to getting it. And I'm just so grateful for the NHPI community advocacy, because it makes an impact on our personal lives.
I love that response, Dr. Choy. Thank you for sharing. Before we go into the audience Q&A, I have a last question for the panelists. The theme of this health summit is to rise up against the challenges that we're facing a year into the pandemic. So I'd like to start with Tavae and ask, how are Asian Americans, Native Hawaiians, and Pacific Islanders rising up to the challenge of disaggregating data?
Sure. I also just want to acknowledge and love what you just said, Dr. Choy, because I so deeply resonate with the idea of not being your family's trusted messenger. Like, you have a whole PhD and they still receive it better from others. And there's a lot of humility in recognizing that. And I think the response then for our communities and thinking about disaggregating data and the way that our folks are rising up is, I really have to tell you about the National PI COVID response team. That when the alarm was sounded, when that was raised around the race and ethnicity data, and credit goes to Dr. Ray Samoa and Dr. Nia Aito'oto, who gathered together Pacific Islanders from across the country, as you know, from Hawaii all the way to DC, forming this National PI COVID response team in April. That was completely volunteer and started with about 25 people and has grown to probably about 300, covering multiple regions and work groups that are seeking to influence everything from policy, data, communications, community engagement, right? That we are engaging the elders and faith leaders and folks who do have the voice and ear of the community, and really thinking about, right, that when there is this notion of vaccine hesitancy, that we don't invalidate those fears, right? Those very real, historically grounded fears that our communities have, that we're not demanding that they trust systems that have many samples of when they have disenfranchised or dispossessed our people, but we ask them to trust us because we are harmed by their death, and that we're deeply invested in their livelihood, and we lose sleep trying to think about how to keep our people alive. So, thank you.
Dr. Yi, did you want to go next?
Yeah, no, sure. I'll say that I think our communities are doing an incredible job. So even before the pandemic, we had to work to fill in the gaps and the failings of the governmental systems in order to advocate and support for the Asian American, Native Hawaiian, and Pacific Islander communities. And I'll highlight in particular our community partners. Again, they're the ones who are on the front lines working around the clock to address the basic needs of the communities. They're dealing with things like food security. They're becoming food pantries overnight. They're helping with COVID vaccine sign up. They're helping with, language and translation. They're really on the front lines, and still they are also signing up to help us push out surveys into the community so that we can collect this disaggregated data. So I think that our communities are doing a great job. I think from a broader scale, I think the great news of all of this is that there has been what I see to be like a larger awakening among Asian Americans across the country. Those of us who are not doing this kind of work every day. There have been tons of grassroots efforts that have popped up, volunteering to escort older Asian Americans to the grocery store or supporting local Chinatown small businesses. But just to bring it back to the data side of things, we actually learn more from about the Asian American COVID experience from our community partners, from social media, from news. We learn more from those sources than we do from the published scientific literature. So we as researchers, we essentially have to, stand together with the community partners as we have been doing for many years. It's all of us working together to pick up these disparate pieces to fill in the gaps where the government systems are kind of failing us to actually make progress. So I think the communities are doing a great job.
Dr. Choy?
I'll second that. I'm so proud to play just one role in a broader Filipinx, Filipino-American community effort to help our community, which is so important in terms of not solely our community, but because so many Filipino-Americans are health workers, it's really a community that is integral to all Americans and US healthcare delivery as a whole. And the community has been doing such terrific work. I've mentioned a number of resources already, and I just want policymakers and corporate and nonprofit organizations and research institutions to please listen.
Okay, great. This was a fascinating panel discussion. I'm really happy with the responses we got. There are a few questions that we got from the audience that I'm going to ask. I'll start with a question for Tavae. An audience member asks, is your organization or anyone that you may know of targeting our PI youth to garner interest in the research fields?
Yeah, so just quick spiel about APAIC. APAIC is a national organization that's based on Tongva territory. We advance social justice by engaging Native Hawaiians and Pacific Islanders in culture-centered advocacy, leadership development, and research. Our most robust leadership development program is Pacific Islander Leaders of Tomorrow, or PILOT, as it's affectionately known. And PILOT is really about grounding our young people in culture so they understand it as an asset, and plugging them into these fields so they also feel like our research is also, it exists as one of our pillars because we know that most, if not all, knowledge that exists about our communities is not by or for us. It's not driven. And so our approach to research is different in that it centers the lived experiences of Oceania and really honors the expertise of our community members. So we have engaged young people in our research, not solely as subjects, but as people who have the wisdom and expertise to drive that. And that, truthfully, I don't trust data about our communities that's not created in partnership with us, because there are very few who understand the nuances of what it means to be Native Hawaiian or Pacific Islander.
Yeah, I love that point. That's a great point. Dr. Yi, an audience member asks you that you mentioned earlier the daily monitoring of Asian COVID experiences. Could you share the access of this research?
do they mean the actual document itself, or what do they mean by access? Do you want to know? Or we are happy to share this document. We have it as a PDF file right now. We also have prepared it as a blog post, so it should be coming out soon in that format as well. I think the important thing to remember about the disaggregated data is, so again, I apologize that I was not able to touch upon the different subgroups that we talk about in that document. I will also caveat by saying that document is specific to Asian Americans. We do work very closely with the Pacific Islander response team and Native Hawaiian partners as well. But as Tavae said, we want to be mindful of the data that we feel we have the kind of capacity to push out and to share in terms of it being truthful and accurate. So I will say that despite the fact that we have it kind of disaggregated by different groups, one thing that we didn't really get a chance to talk about within this panel is the fact that yes, data disaggregation is absolutely important, but there are actually also a lot of commonalities across Asian Americans anyway that we can still learn from. So even in settings where there may not be resources to do data disaggregation, there may not be the push or the political will or the resources to do, to change data collection systems or to even be able to report by different subgroups. Some of the commonalities that we've seen in doing this environmental scan is that Asian Americans, they live in multi-generational households. Many of them suffer from diabetes or pre-diabetes or other existing conditions other underlying conditions that predispose them to COVID. And not to say that, that's anything different from what the rest of the country is experiencing, but it's a unique experience in the sense that a lot of people don't know about the metabolic disturbances or the burden that's within the Asian American community. So it's kind of like you're dually invisible because not many people know that South Asians have really high rates of heart disease or that diabetes is really prominent. Diabetes and hypertension and obesity are really prominent in Native Hawaiian, Pacific Islander, and Filipino communities. So I think, there are lots of, anyway, back to my original point, which is that there are a lot of commonalities across Asian Americans that can still be gleaned from data that's not disaggregated, but we are 100% absolutely happy to share the resource that we have compiled.
Our next question is for Dr. Choy. An audience member asks, how can young AAPIs who are interested in research best set themselves up to insert themselves in these higher ed publicized research roles?
Oh, I'm so grateful for that question because we definitely need more research. And I'm just so pleased that current and new generations of people are still interested in research. And there are a couple of ways. I mean, one is to, at a very basic level, go to your current educational institution, your college, university, and ask what are the undergraduate research opportunities available. Many institutions will have some kind of undergraduate research opportunity. And if you don't see the opportunity that you would like to participate in, I would encourage you to try to create it. And seek out empathetic faculty members who might be willing to provide mentorship. And that comes from my own experience as a graduate of Pomona College, where I didn't have a Filipino American faculty mentor, but I had other faculty mentors of color who were willing to support and encourage me. The other thing you can do is, I've mentioned during this panel, a number of resources, such as the COVID-19 Filipinx resource and response team led by Dr. Nina Ponce, and you could get in touch with the organizers of that research team or a community-based project like Tayo Help. You can get in touch with Brown University's FIRST, the Philippine Health Initiative, and ask to see if there might be a role that you can play. And I encourage and support your interest. Thank you.
Dr. Yi, did you want to add on?
Yeah, I second everything that Dr. Choy said. I'll also just add that a really nice way to get involved is, depending on where you're located, I would definitely just do a Google search for community-based organizations that are in your area that are perhaps serving the communities that you might be interested in helping out. I guarantee you that, regardless of what part of the country you're in, there are community-based organizations all over the United States that are serving different pockets of the community. And increasingly, within our section, we get more and more requests from national partners from all over that are like, we have this really large growing Himalayan population, or over here, we don't know how to appropriately reach the Chinese community that's really growing in East Harlem. So community-based organizations really have their ear to the ground. And while right now they are, very overwhelmed, they are also simultaneously in need of volunteers and help. So depending on what level of research it is that you want to get into, I would highly recommend, as a health disparities researcher, going in from the boots on the ground level and really going in to see what's happening in the community, what the assets are, what the challenges are, and then taking that back, from a research to the research side, and then helping to elevate that in your research.
Tavae?
I just want to add something, I think, from the perspective of EPIC and the work that we're often asked to do when researchers approach us, both undergrad and graduate at any level, or folks who are already established, is we're often asked to be the bridge or connector to Pacific Islander community in one sense. Now, the other sense for other Pacific Islander graduate students is validating their methodologies. And so as folks are exploring that, I do want to encourage a foundational text to our approach with research is Decolonizing Methodologies by Dr. Linda Choy Smith. And I offer it up as a text as people are kind of really exploring this, to think about Indigenous definitions of research, the ways that we're already doing it outside of a Western context in ways that affirm, and that also that, I wholeheartedly value curiosity, but there's another piece about not all knowledge is meant to be shared, right? That there's a sacredness to it, and that we're not wholly democratic in who we allow to hold it, to learn it, to reproduce it. And so wanting folks to be really thoughtful about the ways they come into community and not doing it in a way that's extractive, right? That it's not enough of a reason that it doesn't exist, that nobody's doing it and that's the reason you should research it. But thinking about a topic of how does it actually benefit community, to dive deeper into it.
All right, we have time for one more question for every panelist, and then we'll go into closing remarks. I'll start with Dr. Choy. An audience member asks, what is the biggest barrier to the accurate collection of disaggregated race and ethnicity data, and how do we reconcile what's being reported versus reality?
That's a great question, because there are multiple barriers. So to choose one is, the greatest barrier is tricky. But I want to return to something that I said at the very beginning of this panel, which is that NHPI communities are not monolithic communities. And another point I had mentioned was the way in which stereotypes actually infuse common knowledge about these very diverse and unique groups. And I think this lends itself to the way in which there is a struggle for disaggregating data and data that is beneficial to these communities. So for me, I think the barrier is the greatest barrier is a perception of these diverse communities as one group with one experience, and at its worst, a group that is unimportant, that is other, that is non-American, and that doesn't really have an important voice. And I hope that the words of all the panelists today have shown just how wrong that is.
Dr. Yi, did you want to address the question?
So could you repeat the questions again? I know there were two of them.
Yes, 1 second. What's the biggest barrier to the accurate collection of disaggregated race and ethnicity data? And how do we reconcile what's being reported versus reality?
Okay, it's a pretty tough question because it's a big one. But you know, Dr. Choy had a nice response to that. I think the biggest barrier that I've seen, at least from a mechanistic perspective, and I've been thinking about this a lot from the perspective of you know, administrative data collection systems, so electronic health records, the data that's being reported out on COVID at the CDC level. One of the biggest barriers is that people don't care. They don't think that it's important. They don't, you know, like people who are not used to not seeing themselves in data don't care that there's not subgroup data. It's very complicated to think like, you know, it's not just Asian, Black, Hispanic, other, or you know, and white. It's you know, it's actually Chinese, and it's Filipino, and it's South Asian, and it's, you know, Native Hawaiian and Pacific Islander, and then within Asian American, there's this and that, and it gets very overwhelming. So I think the first thing is that people have to care, and that political will that I mentioned before, like it's just not there right now. 3 years ago, in fact, and so by the way, the subgroup problem is not just a problem within Asian Americans. It's a problem for everybody. It's a problem for all racial ethnic groups. And I think we really saw that play out with the elections, right? Like, oh, wait a minute, the Hispanics in Texas or in Arizona are not voting like the Hispanics in Florida. Like, why are they different? These are the kinds of things that we are increasingly going to see in this country because people within the Black category, within the white category, within the Asian category, the Hispanic category, we're not monolithic. It's across everyone, right? So 3 years ago, the census actually was going to modify the way that they collected race ethnicity. They, you know, the typical way is to say, what's your race? And are you Hispanic or non-Hispanic, right? And that's how we capture race ethnicity. Then the newer efforts are like, oh, what's your Asian subgroup? What's your Hispanic subgroup, right? But they don't really address like the fundamental issue of the fact that all of the racial ethnic groups are very diverse and there's a ton of subgroups within each of those groups. So within each of those racial subgroups. So, you know, 3 years ago, they were trying to change the way that race ethnicity got asked on the census. It was actually 4 years ago now. And OMB at the federal level, like struck it down. And they ended up using the same way that they capture race ethnicity in 2010. So, you know, why? I don't know why, but there's the barrier right there, right? If at the federal level, if at the state level, by the way, at the New York state level, the data disaggregation bill also got struck down in October of 2020. So federal level, state level, city level, if there is no political will to do this, then why? Then why would we do it? It takes money, it takes resources, it takes hard work to do it right.
Tavae, did you want to add on? Okay. On that note, we will go into closing remarks for every panelist. Tavae, we can start with you.
Yeah, I mean, I'm really just sitting with everything that was shared during this panel, and in particular, really hearing like white supremacy is the biggest barrier to data disaggregation, the ways in which it's incentivized not to really see our communities and not to see us the way that we've been demanding that we be seen and treated. Also to note really that the fight for data disaggregation is really for data to catch up to the ways that we are already disaggregated, right? That our communities already organically organize ourselves, and that we are asking for data and resources to reflect where we already are. That we want folks to also just listen to our communities, right? And I think Dr. Choy said this beautifully, and understanding too that data is not an objective tool, right? That in the hands of white supremacy, it will do white supremacist things. That in the hands of capitalism, it will do capitalist things. And so when we talk about data disaggregation and data in the hands of our communities, that we are seeking it and that we are utilizing it in order to heal us. Thank you.
Dr. Yi?
It's hard to follow what Tavae said. She summed it up so beautifully. I think that in terms of closing remarks, I would just say that I would reiterate what it is that I actually said earlier in this panel, which is that it's not just about getting data. It's not just about data disaggregation. It's, and to echo actually what Tavae just said, we have to have people really address their implicit bias of how they look at and interpret and use data for us to actually make progress. It's not enough to, say that we're going to collect it or to have the data for Asian Americans or to have it disaggregated. Then how does that actually get used? Like, there has to be a whole pipeline of action that happens after that. Data disaggregation is just one start of that pipeline. So I would just push for more kind of training and understanding around the implicit bias around Asian American, Native Hawaiian, and Pacific Islander communities, and what it is that you're coming in with when you actually sit down to look at data. What is it? What are your own sort of thinkings about this community that you're coming in with that is a lens that you apply then to this data?
Dr. Choy?
Yes, I did prepare some short closing remarks that bring attention to Filipino nurses. And I prepared them because this is part of my research, but this devastating toll is also very emotional for me. So I wrote, disaggregating data enables us to see the heroic sacrifices of the Filipino American community through their contributions as nurses and other healthcare workers during this current pandemic, as well as past disease outbreaks in the United States. We must recognize their contributions and sacrifices. We must address how to take care of this community by continuing to disaggregate data, conducting research on the community's needs, amplifying their voices. The benefit of caring for specific communities like the Filipino American community is mutually beneficial to all communities because they are caring for all Americans. How we care for caregivers is an essential question for the 21st century. If we don't care for Filipino nurses and other caregivers, who will take care of us?
What a wonderful note to end on. Thank you so much, Dr. Choy, Dr. Yi, Tavae, for your expertise and your open answers to these questions. This will conclude the panel on data disaggregation. We will now take a 30-minute break before the next panel. Thank you for watching.